Friends, today I want to talk about a very important topic, and that's how to fix a botched filler job. So fillers are very popular. We use fillers on a daily basis. Lots of doctors are doing it. Lots of other people are doing it that maybe shouldn't be doing it. But a very common issue that arises is that when the wrong person is doing your filler, they botch up your filler job. It could happen anywhere on your face. And so I want to delve into the topic of how we can actually fix the issue if you've had a filler done that you're not happy with or was done incorrectly, and how do we fix that? So one of the most common issues I see in my office is that when a filler is placed too superficially. And the most common anatomic area where this happens is under the eyes or the tear trough. And so that has to do with the injector inexperience or the injector lack of understanding of anatomy. And so they're just afraid to really put the place in the right plane. And so what happens often is that you get a ball of filler and it shows itself as a blue line. And there's a medical name for that. It's called the Tyndall effect. And the Tyndall effect has to do with the way light reflects off hyaluronic acid fillers. And hyaluronic acid fillers are like Restylane, Juvederm, Voluma. These are all made up of the same material. The active ingredient is hyaluronic acid, which is a commonly found ingredient in our body. It's found in our skin and our joints. But when this filler is placed too superficially in the eyes, when it's sitting between your skin and your muscle, it actually forms a lump with a blue hue. And so the other issue that also happens is that a lot of people get swelling in the area when that filler is placed in the wrong plane. So patients wake up in the morning, they feel like they have allergies, their eyes are swollen. I've seen numerous patients with this complaint, and oftentimes they're brushed off by other doctors as you have allergies. It's not true. It's filler placed in the wrong plane. So I have a simple solution for that. We can inject a material called Vitreous or Hylenex. This is an enzyme that dissolves hyaluronic acid. It works instantaneously when you inject it, but you see your final result in about 48 hours. So we can get rid of this material for you if that filler is injected in the wrong plane in the lower eyelids. As I said, you can use that for hyaluronic acid fillers. Restylane family responds best to it. Juvederm and Voluma can be a little harder to dissolve, but they can be dissolved within 1 to 2 sessions often. Another common issue is that when simply there's too much filler placed in one area, so people just don't like the unnatural appearance of the filler, whether it's be the cheeks or the lips. People feel like they're too filled, they look unnatural. Around the nasolabial folds, people may feel like they have a chipmunk look. Again, the solution to that is we can dissolve that filler if it is a hyaluronic acid filler. A third issue is that if the wrong filler is used in the wrong anatomic area, and again, that comes with injector inexperience when they're just experimenting on you. So we know that there are certain fillers that you should not be using in certain areas. For example, you don't want to use heavy fillers around the eyes. You don't want to use Juvederm or Voluma around the eyes. It just looks terrible. People look tired, they look heavy, they look like they have bags around the eyes. So again, you need to see a physician that really chooses the right filler for the right anatomic area. A corollary to that being, for example, when I inject bony areas, when I inject the jawline, or when I inject the chin, I like to use a thicker filler. So thick fillers such as Radius, for example, it's got a very toothpaste quality to it, and it really stays where you put it in, and it kind of mimics those bony areas where it gives you definition. A fourth complication is lumpiness. So if a filler lumps up, most of the time lumpiness has to do with poor injection technique by your injector. So if the filler is pushed through the syringe too fast, too quickly, it actually balls up in the form of real hyaluronic acid ball or a Radius ball or whatever filler it is. So again, depending on where it is and where, how it's placed, there are different solutions for that. For example, if it's in the lips and it's a soft filler like a hyaluronic acid filler, by simple massage and sometimes it's a hard massage, you really have to press on it, you can break up that ball of filler. If it doesn't respond to that, we may have to dissolve it with an enzyme, with vitreous or hyaluronidase. Sometimes fillers like Sculptra, if you have an issue that it balls up, we have to inject normal saline in there and try to kind of press it with that volume of normal saline around the filler and try to break it up. Sometimes it's worse than that. It doesn't break up with that. Sometimes we have to use a combination of Kenalog and 5-FU to break up that lump. So again, you need to see a doctor who's experienced with dealing with these types of complications so they can get rid of the problem for you. Another issue is the use of thicker fillers. So when a thick filler is used, an example of a thick filler would be Radiesse. You have to make sure you go to an experienced injector because Radiesse is not very forgiving. Radiesse is made up of calcium hydroxyapatite. It's a very thick, toothpaste-like white substance. And it can easily lump up as well. So you really need to see an experienced injector to inject a filler like Radiesse. Radiesse is much, much harder to dissolve than the other things, than the hyaluronic acid fillers. We do actually have a trick to dissolve Radiesse. We use a solution called sodium thiosulfate. Sodium thiosulfate, I have used it, and it does help dissolve if you have a ball of Radiesse, if you have too much Radiesse in place. But again, the take-home message, is that if you're going to use Radiesse, it's a great filler. Make sure you go to somebody who's experienced with injecting a thick filler like that. Along those same lines, there's another thick filler by the name of Belafil. Belafil is a semi-permanent filler. Belafil is made up of polymethyl methacrylate. These are little tiny balls of plastic. This semi-permanent filler, if your injector screws that up, you're out of luck because there's no way to get rid of it. Belafil is also the only filler right now in the United States that needs allergy testing. We actually have to place a little tiny amount of it in your arm and wait a few weeks to make sure you're not allergic to it. So personally, I would say stay away from that filler, from Belafil. And if you must use it, make sure you go to a very, very experienced injector because there is zero room for error when you inject that filler. Lastly, my tip to you is permanent filler like silicone, I would avoid at all costs. Silicone, in my opinion, as a filler does not belong in your body. Silicone is an inert substance. It's found in construction material. We do have medical grade silicone. But the problem with silicone is that since the body sees it as a substance that doesn't belong in our body, it often walls it off. It walls it off. And that walling off process grows with time. So silicone may look good for a few years, but as you get older, that silicone continues to grow. And as your face changes, that silicone will look weird. It looks like it doesn't belong in your face. And you know what? You're out of luck because the only way to remove silicone is through surgery. So personally, my advice to you would be avoid silicone at all costs. I hope you found this presentation felt helpful. It is a complicated subject. But I think it's something that you guys need to know about and choose your injector wisely. And if you have a complication, you need to go to somebody who's well versed in treating complications of fillers. Signing off, Dr. Cameron Rokhsar.